then there will be a lot of questions because I'm going to ask
अभी जाने वाले हैं
and ask questions about things. Okay.
actually we're live in about when it loads.
Yeah, we are almost there. So we have 7 minutes left for 12 for 10 o'clock for you.
Minhaj? Yes.
Sir, we are on live now.
I'm going to use a different virtual background if it's okay for you guys.
Today we have our session about the role of vaccination to control COVID-19. But let me introduce myself. My name is Dr. Saida Saraf Akbar, and I am Infection Control Manager and Microbiologist and Hashmanis Group of Hospitals. And as we are talking, as we are our very senior speakers today to discuss about COVID-19 and the role of vaccination to control COVID-19. But first of all हम थोड़ा सा COVID-19 के हवाले से भी डिस्कस कर लें कि COVID-19 है क्या. COVID-19 is a pandemic, is a global crisis which devastating health, जो जिसने आजकल जो है पूरी दुनिया को अपनी लपेट में रखा है. और हम जहाँ तक अगर हम कोविड-19 के हवाले से, तो आजकल सबको मालूम है कि हमें किस तरीके से एहतियात करनी है और किस तरीके से ये जो है एक फर्द से दूसरे फर्द में स्प्रेड होता है. और हमें इसमें जो है कौन कौन से ऐसे साइन एंड सिम्टम्स हैं जिनको देखते हुए हम पेशेंट्स को जो है डायग्नोज कर रहे होते हैं, हम उनको जो है फर्दर उसके लिए भेज रहे होते हैं कि जिसमें आपके पास फीवर है, कफ है, इस तरह के जो है अगर साइन एंड सिम्टम्स आपके पास हैं तो मे बी जो है पेशेंट ऑफ कोविड-19. लेकिन आजकल हम एक और चीज़ के ऊपर भी डिस्कस कर रहे हैं कि कोविड-19 की वैक्सीनेशन के हवाले से कि आजकल पूरी दुनिया में जो है कोविड-19 की जो है उसकी ट्रीटमेंट किस तरीके से करनी है, उसको हमें जो है लोगों को वैक्सीनेटेड किस तरीके से करना है. तो इसके बारे में लोगों के जहन में आजकल बहुत सारी ऐसी बातें हैं जिनके बारे में वो जानना चाहते हैं, समझना चाहते हैं कि अगर हम ऑल ओवर द वर्ल्ड अगर हम कोविड-19 की वैक्सीनेशन को अगर हम इंट्रोड्यूस करवा रहे हैं तो कौन कौन सी चीज़ों के बारे में हमें मालूम होना चाहिए. तो इन्हीं सब बातों के ऊपर आज हम जो है डिस्कशन करेंगे, जिसमें हमारे पास बहुत ही ज़्यादा हमारे पास एक 3 रिस्पेक्टेड हमारे पास स्पीकर्स हैं, जिसमें से हमारे पास सबसे पहले हमारे पास जो है मौजूद हैं डॉक्टर मिनहाज अहमद Qidwai sahab, who is M.B.B.S, M.P.H, M.B.A, CMC and Health Management and Public Health Consultant at Unet Consultant. So let's invite Dr. Minhaj Ahmad Qidwai to present his presentation.
Thank you, Sadaf. Can I have the screen share, please?
Sure, sir. So now you can share your screen with us.
Is it shared?
Not yet, sir.
Is it shared now?
Not
yet, sir. Okay. Yes, sir.
So is it shared now? Okay.
Yes, sir.
Bismillahirrahmanirrahim. Today's topic basically is regarding coronavirus and the vaccine. basically, coronavirus and vaccine, we start with. COVID has been a paradigm shift for us. We are going into a straight line into our routine chores, but unfortunately, we came across with COVID, and now we are into a paradigm shift that we have to move and see how we have to face this problem. So basically, we are in a panic situation due to COVID, and it has affected everybody on a global basis. So this is a problem that caused by COVID-19. So somebody can deal with a fixed mindset. Uh, we can have a growth mindset, or we have to innovation and into a mindset where we can innovate new things, how we can move forward and face this challenge. So what are the issues in managing COVID? There are self issues that we have to deal with in terms of our family, our work, home office, emotions, burnout, fatigues, time, fitness. Then the system issues, there are health services to people, institutional support, utilization of resources and coordination. Then there are state issues that we have to deal with in terms of disease control, roles of our disaster management authorities, with health departments, resources, vaccines, provincial issues. So there are state issues that needs to be dealt with. And then we have the issues to deal with the society in terms of the SOPs, the behavior change, patients, families. So basically the issues that we are dealing with managing COVID are at the level of self, state, society, and the systems. And we are forced towards to bring a change in our daily routine of life, and deal with the COVID definitely is an issue with us. So the prescription for the RS therapy, as I'm proposing, is we have to eventually face COVID. When we are dealing with the self-management in terms of facing COVID, definitely we are fearful. Future events appear real. This is what how we describe fear, and then or forget everything and run, or we can face in everything and regulate ourselves. So this is important for the self. We can allay anxiety, take adequate rest, be commitment, and also have some communication strategies to deal with the issue. Then feeling emotions, exercise, that's important for us to ensure. Changing behavior is very important. We have to be observant and optimistic in dealing with this issue. We have to value today. It's important that how we live today and how we value our life in terms of dealing with COVID. We have to build our immunity through the diet and other factors, and be determined and ensure disinfection in our daily life. So basically, we have to manage ourselves to deal with the COVID situation. But the more important thing is that we have some behavioral issues that some people are skeptic in dealing with the COVID. That some people feel that is special and COVID will not affect them. People are unaware. There are warriors. There are people who are fearful, confused. Then we don't know when the panic button which has to be pressed. Then there are decision delays in terms of dealing with COVID. So where are the decision delays in terms of COVID? It's as level of pre-onset of COVID, onset, then again onset, and then the level of complications. So the first is basically that we are not aware, there are no precautions, and then do we go for precautions or not? That's another issue. That's the first delay. And then this is dangerous for society if we don't take the precautions at our individual level. And then at the onset of COVID, systems are you aware of symptoms? And then the testing, availability, affordability, then the stigma of going for testing, getting diagnosed for the being a positive. So how people react with that. There's a second delay. And then if the test come positive, we have to isolate ourselves, and then the family tracing also has to be done. In case of the onset of COVID, we have to see that the testing is then again when we are feeling free of disease, then for the complications, what to do, where to go. There's a third delay, and then the hospitalization and the recovery. And then when the complications do occur, we do visit the hospitals where we go for our hospital checkup. Then that's again their delay. The complication may occur, and then there is issues if the death occurs where we have to go for the uh, body recovery in terms of the issues that we have. There are a lot of violence also takes place in terms of our behavior when we do not get the body and on in time because people are not aware of the procedures. And then the burial is also another issue where we have to follow some SOPs. So there are some delays in terms of decision making. So ultimately, all boils down to our behavior. And we have to ensure that there has to be a way forward for our behavior change, and that is basically in terms of initial stage where we deny. We have to ensure that COVID is present. So then we think about how to change ourselves. There's a contemplation phase where we have to choose in how to change ourselves. Sometimes we do have masks, but we keep the mask in our pocket. And I usually ask people, "Where's a mask?" They say in our pocket. So and I ask them to please take out a mask and put it yourself. So that's very important that we have to ensure that people comply. So then we have to make people determined in terms of change into the behavior, and at the same times we have to ensure that they behave in terms of actions. The actions have to be stabilized, and we have to help the implementation of change at the same time. But at the same time, their relapse may occur if people don't comply. So we have to ensure that we maintain our support to the people, and then they start their actions and maintain their actions in terms of following the prevention aspects. And then we have to ensure that the symptoms are there and they people keep wearing masks and test appropriate measures. And we have to see that people become a real model in terms of the behavior change. So we have to ensure that there's a behavior change which takes place. In terms of society, again, people are fearful in terms of COVID. So we have to see that we face everything and revolutionize ourselves, accept the situation, ensure the communications reach to us properly through the society. We have to empathize with the people, collaborate with each other, and ensure that we satisfy each other. Then organization have to play their own role in terms of the support, and we have to verify all the information that we receive. Sometimes we forward information without verifying, and that's quite issue in terms of we are sending wrong information to the people. Identified resources to support system. It's our role as a society to support each other, the government and the setup that we have to take place in terms of supporting each other. And then the disinfection campaigns can also be run by the society. So that's the role of the society in terms of dealing with COVID. When we deal with the state, again, there's fear at every level, but then face everything and rise is our motto of our government at the moment. And we are rising. We have faced COVID. We need to have appropriate policy decisions. The confident leadership is very important for us. We have to ensure that the economy sustains, engaging with the people, education and enforcement of the SOPs is there. And then we have to ensure that there's a coordination, control, change behavior through communication takes place. And then we have to be open and ensure that the vaccines procured, developmental areas are identified, information management is there, and then the devolution process at the district level, local body is strengthening, at the grassroots levels are strengthened to ensure the decision making is at the grassroots levels. As far as the systems is concerned, again, the fear is there, but we have to focus on everything and regulate the system. It's very important. We take appropriate resources in terms of managing the system. Community management and community engagement is very important in system establishment. empowerment of the community to make sure the decisions are there at the grassroots level again, control the disease as far as system is concerned. Then the operational management should be there as far as the systems. And then ventilators have to be ensured for people through the system where the complications do occur and the ventilators are required. This was quite an issue in terms of when we started the COVID management. So that was an issue. Now we are in a developmental phase. We are developing and manufacturing ventilators in Pakistan. That's a good development. And then institutions level, we have to ensure the isolation centers and quarantine facilities are available for the general population. And then last but least, and the most important, we detect, test, isolate, treat every case, and trace every contact. Contact tracing is very important, and this was very much achieved in terms of the contact tracing, especially in, I will quote example of Vietnam, where they trace the contact at the third contact level, and then that was the reason that we don't see any deaths occurring in terms of the disease. That's important example in terms of Vietnam. In terms of vaccine, there's a fear of vaccination. Availability is an issue. There are concerns. There's efficacy and safety issue. There's a conspiracy issue. There's observations. Vaccine selection is important. Injection safety ensurement is important. And disposal of waste is very important in terms of the waste. Currently, the vaccines which are available are AstraZeneca, Moderna, Pfizer, and the Sputnik. And the efficacy of Moderna and Pfizer are 95%, quite higher. But there are issues in terms of the storage of the vaccine, especially with the Pfizer. So there are a lot of issues that we have to deal with in terms of while we are dealing with the selection of the vaccine. So definitely the fear of vaccination is there. So we have to face everything and read about all the information that we can get. The availability is mRNA based are Moderna, Pfizer, and adenovirus based are Astra and Sputnik. Then the concerns for the vaccine: will the vaccine prevent us from getting COVID? Will the vaccine prevent transmission of COVID? After vaccination, do we still need to follow SOPs? How long the immunity will last? What are the risks in receiving vaccine? Will mRNA-based vaccines bring any genetic mutations? Then the efficacy and safety of the vaccines. Then some conspiracies issues are there. There's reality of COVID, the myths that are floating around. So that's also there as an issue. In some observations, there are past vaccine failures dealing with such types of areas. So that's another issue. And unknown future of the vaccine, it has not been tested for a long time. So unknown future is there. Then there's a push for a quick solution for the vaccine. Not long period of trials are subjects. The JJ trial was stopped. JJ's Johnson and Johnson trial. Then there's an Operation Warp Speed by USA, which is about 11 billion investment by USA government, and it's a combined effort with the chief operating officers in general. And then the vaccine selection, is it in our hands? Will we forced for it? Injection safety is issue, misuse of used syringes. We have seen this lot of happening earlier in case of HIV/AIDS. And then disposal of waste, there are no comprehensive mechanisms available in terms of dealing with medical waste. So just to summarize, we have to live away with fear, face everything in rise, allay anxiety, take appropriate measures, control what is within, empathize with each other, ensure communications are there and the right communications received, be optimistic, value today, ensure vaccine research and development takes place in Pakistan. Information has to be screened, and disinfection, and develop immunity in terms of dealing with COVID. So definitely everybody is looking for the vaccines, but at the same time, we have to value our health and the vaccine at the same time while dealing with this pandemic. And I'll end with the quote from our Prime Minister: when we emerge from this challenge, we will be a totally different nation. Those who take such times as a test and face it head on as a challenge come out stronger. So I'm sure Pakistan will come out stronger in this case. Thank you very much.
Thank you so much, sir, for this very informative talk about forest rapid system face COVID. And I hope you will learn about कि आज लोगों ने इस बारे में कि बहुत ही ज़्यादा एक informative session जो है हासिल किया होगा. And thank you so much again. Now we have our second speaker, Professor Dr. Rafiq Khanani, who is M.B.B.S, FCPAT, and Ph.D. Professor of Pathology, LMCD, Molecular Pathologist, and Director, Hashmanis Laboratory. Sir, now is your turn. You can share your slide with us.
Assalamu alaikum. And good morning and good night, wherever you are. It's a great pleasure for me to be part of this webinar. And I am sincerely very thankful to Professor Omar Bagasra for joining us. The information that we are talking today is definitely correct at this time, but since the pandemic and the COVID infection is evolving at such a rapid rate, that some of the things that we are talking today may not be true for tomorrow. For COVID prevention, we all know that the COVID is an ongoing pandemic, and it has already infected millions of people, and more than 1.5 million deaths have occurred across the globe. Universal vaccination, that everybody who is eligible to get the vaccine should get the vaccine if we have to control this pandemic at this stage of time. The word that I'm using over here is that we have missed a great opportunity earlier when COVID started in Wuhan, China. That was the time that the globe should have responded by taking the precautions and preventing the spread of the virus. But we have lost that opportunity for certain reasons. And now we are in the middle of a pandemic, which in the history, in my lifetime, I haven't seen such a damaging virus, which is creating havoc across the globe. So now it's crucial that the COVID vaccine, which is available, is safe and effective and delivered to everyone who is in need of it. In fact, everybody is in need of it. So those with the role of delivering the COVID-19 vaccine program need to be knowledgeable and competent so that they can gain the confidence of the communities. COVID virus is a disease that is caused by an infection with SARS-CoV-2, which is a coronavirus family, and SARS-CoV-2 stands for Severe Acute Respiratory Syndrome. And COVID is an acronym for the coronavirus disease. And the word 19, which we use, is because it was first time declared in 2019. Now, coronaviruses are known to cause diseases in animals and in humans as well now. So that's why it's classified as one of the zoonoses. We have seen the SARS-CoV-1, and now this is SARS-CoV-2, and earlier we have seen the Middle East Respiratory Virus MERS. All these two viruses could not spread globally widely because of the severity of the illness that it caused and the response of the countries in which these viruses were first identified. somehow globe has failed to contain the SARS-CoV-2 virus at its earlier stages. Now, all of you know that the viruses are much smaller than the bacteria. Somehow the cartoon that has been depicted and propagated, many people misunderstand that this is something that's very big and that we can see. But unfortunately, these are so small that we cannot even see with the ordinary microscopes. There are certain diseases which have been controlled by the vaccination. Polio is an example which is about to be eradicated except for a couple of countries like Pakistan and Afghanistan. The diseases which are preventable by vaccination includes measles, mumps, rubella, influenza, hepatitis A, hepatitis B. Influenza viruses are RNA viruses, and there is a challenge that they are constantly mutating. So it is difficult to make the vaccines which remain effective for a longer period of time. And that's why most of the time we have to change the vaccine every year. SARS-CoV-2 is also an RNA virus, and we don't know that the vaccines which are being produced these days, how long their efficacy will last. So there is a mesmerizing effect of this coronavirus structure. Because of this, it has created lots of illusion that that's something which can be controlled and prevented by seeing it. Unfortunately, it's not like this. The virus has got a spike protein which is required for the virus to attach to human receptor cells. And these receptor cells are present in the mucosa of our nasal cavity, nasopharynx, oropharynx, and our eyes. And if virus gets entry into these places, it finds the receptor, it enters into the cell and it starts multiplying, and it may produce a disease or it may cause an infection. The difference between infection and disease is that every infection cannot culminate into a disease. And that's why this is one of the reasons that many people who are infected with these coronaviruses, they do not feel sickness or ill, or the illness or sickness is delayed, and those people who are infected keep spreading the virus into the community. So for virus to be transmitted from one individual to another or one place to another, there are certain requirements. There should be a portal of exit, and then there should be mode of transmission. In case of coronavirus, this is coughing, sneezing, or even speaking loudly, or even at the normal speed. And sometimes even when you are breathing normally, if the viral load is high, the people keep transmitting the virus outside their body. Then there is a requirement of a portal of entry, which is most of the time mucosal surface, which are having the receptors which receive these viruses, and the virus can enter the host cell. COVID-19 spreads primarily from person to person through droplets that are emitted from nose and mouth. And if the person coughs, sneezes, speaks, or even during breathing. And these droplets and viruses can survive on the surfaces for a certain period of time. But nowadays we realize that the transmission through contact of surfaces is much less common compared to the airborne transmission. Now, this is a typical example of the cycle through which these viral infections keep perpetuating in a society. That there should be an infectious agent, which in this case is SARS-CoV-2. Then there should be a reservoir. These reservoirs may be humans or any other animals. In case of COVID, it is mainly the human reservoir which is responsible for the spreading of the disease in human population. And the portal of the exit from one individual who is infected include mouth or nose through coughing, sneezing, or even talking. Then the mode of transmission is generally airborne or direct contact with the virus on a contaminated surface. From this, the virus may enter into through a portal of entry, which is a mucous membrane of the nose and mouth and sometimes eyes. And the person in which this virus is going should be susceptible, should be able to accept and receive this virus and allow it to multiply. This is the vaccination by which we can decrease the susceptibility of the host and increase the resistance of the host, so that the virus cycle cannot continue and new infected person is not infected and it's unable to transmit the virus. So the role of vaccination is over here. And Professor Omar Bagasra will be enlightening us on how these vaccines are produced and how are they going to improve the situation which the globe is facing today. The vaccinations generally work by the antigens which are introduced into the host so that the immune system is trained to respond to these viral infections. And once the person's immune system is trained, the new antigens, when they enter into the body, these antigens are responded by the host cell's immune system so that they do not allow the virus to be established into the host and cause disease. And that's how this cycle of propagation can be stopped. I'm thankful to Professor Omar Bagasra for taking out the time almost in the middle of the night for this program. And Dr. Sadaf Akbar, Dr. Minhaj Qidwai, Hashmanis Labs, and all the participants. And Public Health Program of England, some of the slides have been taken from there. Thank you.
थैंक यू सो मच सर फॉर दिस वेरी इंफॉर्मेटिव टॉक के आजकल जो है लोगों के जहन में सवालात होते हैं हमारे कोविड वैक्सीन के हवाले से कि किस तरीके से जो है कोविड वैक्सीन को हमें इस्तेमाल करना है और किस तरीके से जो है इसको हमें आजकल किन किन लोगों को इसकी जो है बेसिक ज़रूरत है, ये भी आजकल लोगों को जो है बहुत ज़्यादा जानने की ज़रूरत है। तो आजकल तो आज आपके जो है इतने इंफॉर्मेटिव टॉक के ज़रिए लोगों को ये चीज़ की जो इन्फॉर्मेशन हासिल हुई है कि ये जो है हमें किस तरीके से हमें कोई कोविड वैक्सीन की जो वो है कि इसका रोल क्या है, इसको हमें जो है आज वो लोगों ने समझा। नाउ वी हैव आवर थर्ड स्पीकर डॉक्टर उमर बगाजरा। He is M.D. Ph.D. Professor of Biology and Director South Carolina Center for Biotechnology. बट मैं इनको सबसे पहले इस सर को इनवाइट करने से पहले मैं सर का बहुत बहुत शुक्रिया अदा करना चाहती हूँ कि आज सर ने हमारी ये जो है इतनी ज़्यादा जो है सर उस पर रिक्वेस्ट पे कि अब वो हमें इस सेशन में ज्वाइन करें और अभी वहाँ पर साउथ कैरोलिना में जो है 12 AM का टाइम हुआ है। तो इतने सर ने हमें जो है उस अपनी टाइमिंग स्केड्यूल के लिहाज से सर ने हमें आज यहाँ पर ज्वाइन किया कि लोगों को हम जो है कोविड वैक्सीन के हवाले से इंफॉर्मेशन दें ताकि लोगों के जहन से में जो मुख्तलिफ इबाम है, जो लोगों के जहन में मुख्तलिफ इक़साम की कन्फ्यूजन है, उसको हम जो है एक अच्छे तरीके से एक जैसे जो है दूर कर सकें। तो बहुत बहुत शुक्रिया डॉक्टर उमर बगाजरा साहब कि आज आपने हमें ज्वाइन किया और लोगों को जो है हम इस जो है मज़ीद हम बेहतर इंफॉर्मेशन दे सकेंगे। So sir, please let's share your screen with us.
Assalamu alaikum. Thank you very much for inviting me. I'm very, very honored, greatly honored to be part of this program and part of this beautiful conversation we're having about COVID and about vaccination. So my goal will be to, I hope you see my screen now. Am I correct? You see me, right? You can see my screen, right? All of you can see my screen?
Yes, sir, we can see your screen.
I just want to make sure that we are on the same page.
Yes, we are on the same page.
So my goal will be to assist you in figuring out what this all vaccine is about and why we want to use vaccine and what is the role of vaccine in COVID. What are we doing with this whole 9 yards? So my goal will be to share with you how we doing all this thing, why we doing this. So vaccination is not new, by the way. Vaccination is very, very, very old. And I can tell you with great deal of honor that Muslim people are the one who actually started the vaccination. Most of the time when you read literature, you will see Edward Jenner, who started the vaccine. The word vaccine actually come from vaccinia virus, which was against the smallpox. But during the Ottoman Empire for centuries, they were doing vaccination against vaccinia virus by using a dry powder of pustule. When somebody has smallpox, they develop this horrible pustule. They would dry them, they would make powder under the sun, and they will make a minor scratch, and they will give this, put that on, or it's called variolation. I'm going to talk to you in a second about this, called variolation. So variolation is very common. So was very common in all through the Muslim world and many other part of the country, other part of the world at that time, at the time of Ottoman and Osmani Khilafat. So vaccine we use all the time. As you know, we use 16 or 17 vaccine for childhood. Before the baby is 24 months old, we have given them 17 different kinds of vaccination. What vaccine does, vaccine is a very clever technique. It's actually fool the immune system that somebody is actually infected with a virus or bacteria or disease causing pathogen, a pathogenic agent. This could be virus, could be fungus, or could be bacteria, or could be mycobacterium. So what we do, we take a small part of that agent, pathogenic agent, and we inject them. And this is not the whole virus, it's not the whole 9 yards. It does not infect the person. So bacteria, fungus, virus, and other pathogenic agent, we just take a little piece of out of it. It's almost look like if you think of this cell phone, you take the just cover of the cell phone, just like this white cover. And that's what we do. We actually take a part of it, we call them antigen. So that part, this cover in scientific word, for example, will be called antigen. And then we inject them, it does not cause any disease. But your immune system believe that you actually have pathogenic agent and your body make antibody to it. It respond to it by making a defensive mechanism, we call them antibodies. Those antibodies will actually protect the person when that person is really infected with a real pathogenic agent. So here comes the vaccine. This is what we do with vaccine part. My slide is not moving. Here we go. So as I mentioned to you, a long time ago, the vaccination started by Ottoman Empire, many, many centuries before British people even, or the European people knew that there is something as variolation. So what happened in 1715, Mary Wortley Montagu, she was a wife of a British English ambassador to Turkey, which is the Ottoman Empire. And she watched how people are immunized against smallpox. Smallpox is extremely deadly, horrible disease, and disfigures your face. Smallpox is extinct now. It's basically completely under control, and we don't get smallpox anymore. So when she came, 1715, she came and she watched, and then when she returned in 1718, she basically told people, and she propagated how to vaccinate people against smallpox. There was no cure for smallpox. And that way, Edward Jenner himself was variolated. So Edward Jenner, who's supposed to be a father of vaccination, the word vaccination come from his vaccinia virus immunity. Actually, he was actually vaccinated with that technique which Muslim people have invented centuries ago. So you will notice that smallpox wasn't very common in Muslim world during the Ottoman Empire. And Ottoman Empire lasted for 700 years. So you can see we don't realize that we have been learning about Western world, but we don't realize that many of the invention which is we claim to be by European, they are not European. They're actually Muslim invention. To make the story short, now this is what we're talking about, this cell phone. This is the virus. This is my whole cell phone. What we do, we take the white part out of it. This is the spike protein. This is the glycoprotein. We take it out and we put in another virus or another agent which does not replicate most of the time. They are not, this is not the real virus. Actually, we genetically engineer this thing, and it's only make this glycoprotein most of the time. I'm going to come to it in a second, that there are many variations of this technique. So the most common technique is being used now is we use this glycoprotein and we genetically engineer another agent which is not pathogenic, does not cause disease, is only make this protein, and the body, when we inject them to human, our body think we are infected with the coronavirus, COVID-19. And it will make antibodies to it. So if somebody is really infected with the virus, they will immediately stop this infection within days, because they already contain lots of antibody against that particular glycoprotein. Now, the two way of doing this, there are more than one way to skin a cat. So one way to do it, to only express this in a specific way. That's what the different Pfizer and Moderna and various other vaccines are being Sputnik, they're using this. There's other way to do it. If suppose somebody got really infected with the whole virus, as Dr. Khanani mentioned, your body will suffer. Person will be infected, and small percent of the people, about 2% of the people would get really, really sick and die. Other small percent of the people will get sick and be in a hospital, they'll be released. The reason is that this is very pathogenic virus, terrible virus. All right. So what we do with the other way of making vaccine, I'm going to go to this. This is actually a life cycle of how coronavirus infects. It is a coronavirus. It will bind a specific receptor. It will enter through your breath, generally through your breath. You take in a breath, it's in the air, you touch it, you touch your nose, you will get into your body. It will go and home into two places. Right away, within hours, it will attach to your lung cells, a special receptor, we call them SEH2 receptor, and it will also bind your olfactory neuron. This is the part in the brain we have. It's a little ball, little round ball, which is right behind. If you see my finger, right behind this, there's an olfactory bulb. This is the way you smell things. So within an hour, it will be, you can smell nothing. You smell this, you have no smell. You have sense of smell is gone. Now, many people will just have that. They won't be able to smell nothing. 85 to 98% of the people lose the sense of smell within an hour after exposure. Then it will move into your lung, and if you are lucky, you will be okay. You will just have a cough, a little bit of fever, and you'll be fine. But in many people, a large percent of the person going to have an infection of the lung. And your smell would not recover till your lungs are clear or you die, whichever comes first. All right, so that is the mechanism of this COVID infection. And what we do, we actually fool the immune system. We make sure that our immune system. So here we go. So here is you have gone through your nose. and it got into olfactory neuron, you can smell nothing, and your lung will be infected. Within short time, your lung will be gone. It will eat up your lung. It will basically digest. Your lung will liquefy part of your lung and you will not be able to survive. But not everybody has that problem, but a good percent of the people will have this issue. Now, let's go and talk about what we talk about next. So what we're doing by vaccination is not dangerous. So COVID vaccine should be safe. All the COVID vaccines should be safe. Whatever the technique they use, they all should be safe because it had been tested in 50 to 100,000 people. Some of the vaccine, which is Chinese vaccine, has been tested in millions of people. So vaccine is not new. Who should not take this vaccine? Okay, everybody should take this vaccine. We have not heard if children can take vaccine or not, because children have to have a smaller amount than the adult will. And this is being done as we speak. The trial is going on. Pregnant women should not take the vaccine because this is the RNA virus. Even it is RNA-based vaccine. It's RNA virus, but virus vaccines are also, some of the vaccines are based on RNA virus. They have not tested pregnant women. So pregnant women should not take the vaccine. Any woman who is want to get pregnant, she's trying to get pregnant, they should not take this vaccine because we don't know what can happen. Till the clinical trials are done, clinical trials are going on as we speak. Now, this is nothing new. We do not give pregnant vaccine, HPV vaccine. We do not give them MMR, mumps, measles, or rubella vaccine. We do not give them influenza, live influenza vaccine. We give them dead influenza vaccine in their nose, dead virus. Okay? So we just spray in the nose, dead virus. We do not give them live influenza virus because influenza virus can cross the placenta and can hurt the baby. We do not know if they're going to hurt the baby or not, but still we have to be careful. I want to go back because I want to show you this thing. And that is and some people who traveling, we do not give them pregnant women traveling vaccine like yellow fever, typhoid fever. So not giving COVID vaccine is totally logical at this moment. All right, at the moment we don't know. So now let's talk about Pakistan. We have talked about the world, we talk about the universe. What is good for Pakistan? What vaccine should we take? Now remember, I showed you a picture that they're making vaccine against the spike protein, spike glycoprotein, but they are not the only protein in the virus. There are many other proteins. If somebody get infected, they would make antibody against multiple different kinds of protein, which can stop the virus. Okay, which is stop the replication of virus as soon as your antibodies are made. So what is the ideal vaccine for Pakistan? Safety. Dr. Qidwai mentioned and Dr. Rafiq Khanani mentioned. Safety is the most paramount. Most important is a vaccine. How stable the vaccine is. We do not have refrigeration in every part of Pakistan, especially minus 80-degree refrigeration is rare in Pakistan. So quite obviously, Pfizer vaccine would not work because we don't have facilities to store the vaccine at minus 80 degrees. This is minus 80 degrees. This is a very cold. So we need vaccine which survive 4-degree refrigeration for 30 to 60 days, and I'm going to talk about in a second. We need to have a single dose vaccine. Pfizer vaccine, Moderna vaccine, Sputnik, a 2-dose vaccine. Why is that? It's a very long story, but what happened in this case of virus, the scientists think that when you infected first time, you develop lots of IgM, which I won't go into either, and then when you do second dose, you get lots of IgG, which lasts for a long time. This is still experimental. For Pakistan, if you give a dose, one dose to a person is only 50% protective. Moderna, Sputnik, and Pfizer vaccines are 50 to 60% at the most protective for single dose. We cannot trace people who've taken vaccine in Pakistan to do another dose, and how effective, how costly it is. Dr. Qidwai mentioned how costly they are. You need a vaccine which you cost only 1 rupee. 1 rupee costs not more than that, because our people cannot afford $40, $50, $60 for a single dose of vaccine. Remember, Pfizer and Moderna are subsidized by the US government. They spend $11 billion each for each vaccine. All right. So this is not something we can do. Now I'm going to talk about one more thing. It's called broad and long immunity. So I just mentioned to you, 2 doses are short immunity. Immunity lasts very short time. And this is the reason you have to do another dose after 21 days. Can we get that many 140 million people to come back? Or 100 million people to come back and take another dose? Unlikely. So vaccine has to have broad effect and long lasting effect. Now, so what we know, when somebody is infected with real COVID virus, they have immunity for 5 months. Even they didn't get any symptom. They survived, they didn't even know they were infected. Their immunity lasts for 5 months. Why is that? Because this is the whole virus. The whole virus vaccine seemed like is the more logical thing to do. And this is the way cost effectiveness, we have easy administration, nasal or shot is fine. Dr. Qidwai mentioned about changing needle. We know about HIV because I did this whole 9 yard about HIV. People will keep reusing the same needle. So a vaccine which hopefully will develop soon, oral vaccine or nasal vaccine, like we have polio vaccine, like we have flu vaccine, a nasal spray will be more suitable for Pakistan, but any developing countries in Africa, in part of Asia, heat is stable. We cannot have minus 90 degree, minus 80 degree refrigerator vaccine. It would be very difficult to do, and it has to be multivalent. This means it has more than one places where it can infect. I'm going to go back. So we need a multivalent vaccine, in my opinion. Where are we going to get that from? So Dr. Bagasra said multivalent vaccine and should have a long-lasting immunity. So let's talk about this right now. So here you have Pfizer vaccine, which is approved, was made in the collaboration with multiple countries. It is being used right now in US and UK. It's an RNA-based vaccine. And I want to talk about in the next slide, I'm going to talk about RNA and DNA-based vaccine and inactivated vaccine. Now you have a whole virus vaccine. This means you inactivate the virus. Basically, you grow the virus and you fix with formalin and radioactivity. This virus cannot multiply. This is done. So formalin fix, radiation fix is same thing we take for polio. SARS vaccine, seven vaccine we take, we give it to our children. Many of those vaccines are not the one in the mouth, the one we give an injection. They are formalin fixed whole virus vaccine. And they are cheaper to make. How cheap? Really, really cheap. 1 rupee and less to make it and deliver it. There's another inactivated virus vaccine. This is non-replicating vector virus vaccine. This also required 2 doses, but it has a DNA vector. I'm going to talk in a minute what DNA and RNA vector mean. And there's another inactivated viral vaccine that can be made in Pakistan. It could be made anywhere. That's very easy to make. If Chinese are giving it for free, we should take that because that is cheap vaccine and it's so easy to make, and it's a multivalent. It's like getting a viral infection, like I just mentioned to you, and you have no symptom. And it's good for 5 months, 6 months, maybe years, because so far they've done 5 months. In 5 months, it is still there. So we have to think in Pakistan in a smart way. However, if this vaccine is available, other vaccines are available for free, why not? But this vaccine, which I'm talking about, whole inactivated virus, is been around, it's been given to all this part of the world. This blue, all these places, they are being given now as they speak. As I'm speaking to you, millions and millions of people are taking this vaccine, by the way, including Pakistan. Part of the Pakistan is Pakistan is part of the clinical trial for this whole virus inactivated vaccine. All right, now. So now what we say, there is a natural immunity, a pre-existing immunity against COVID virus. And it is more common in poor nations, including Pakistan. Dr. Khanani has been working on it, as you probably heard his talks. What happened is this: coronavirus, COVID-19 is new. We discovered that in October last year, 2019. But coronavirus, human coronavirus are not new. Actually, coronavirus infect almost every living thing there is. By the way, coronavirus is a very common virus. We all are infected with these viruses. These are human coronavirus, and they are very, very, very common. Now, some countries will have a lot more, and they provide some immunity. We still have to take vaccine, okay? But what they do, they provide some immunity, and as you notice, that in the Western world, they are very common in children. And we have not done comprehensive study in Pakistan or other developing nations. I bet this is very common in most of the developing nations, especially Muslim nations. Why would I say that? The reason they are most common in young children in Europe, because the kids are gathered together, young kids, and they are in a small classroom because they're little. So they're a small classroom, you have 30, 40, 50 kids. If one got little minor, they cause very, very, very mild cough or a cold. Not even a cough, cold. And everybody will get it. And young people show some degree of immunity against it. So you notice the young people do not get very much COVID infection. In the United States too. The adolescent and young people are partially immune because of this. And I have several papers. I can send you if anybody wants to. So it causes very mild symptoms, but it cannot replace the vaccine. So I'm emphasizing that everybody should get the vaccine. Vaccine is safe, and everybody we should take all the vaccine. But in Pakistan, in many parts of Africa, especially the Muslim country, there is a partial immunity against that. And some people say that wherever there is a malaria and BCG infection, when we give BCG vaccine, the incidence of COVID are less. They have less mortality. So mortality is lower because somehow it gives a partial immunity to the person. Now, let's talk about DNA and RNA-based vaccine. RNA is extremely unstable in room temperature because we have RNA virus, RNA enzyme in everywhere in our body. All parts of our body, everything liquid in our body, including our sweat, our eyes, our mouth, all part of our body, which is liquid, has RNases. It would digest the RNA vaccine. So it's the reason they had to keep it minus 80 degree, minus 90 degree, because this is a very unstable molecule they're using as a vehicle to make the vaccine. DNA is very, very stable, and DNA vaccine is more, I don't know if you noticed, but DNA vaccines are being used You can see this is a DNA viral vaccine, is Sputnik 5, and many of the other this is RNA, Pfizer using RNA, and this is one of the reasons they have to use very low temperature. And they are only against spike. This is also against spike protein. These are whole viruses or part of the protein, which are multiple protein, which gives you multivalent vaccination. All right, I think I stop here. I think I way over what my time was. Okay, now I'm sure all of you thinking, oh God, I have lots of questions to ask. So ask away. I hope I clarified myself about a lot of things, but I probably raised a lot of questions in your mind.
Thank you so much, sir. It is very much informative.
I'm going to stop sharing my talk. Let me do that real quick. Stop sharing. Stop sharing.
जी
Stop
सर
sharing.
आप अपनी शेयरिंग स्क्रीन को स्टॉप कर दीजिए तो
I
we
think
will.
I stop sharing. Here we go. I'm stop sharing myself.
Yes sir, exactly, you have done. Sir, it was a very wonderful and informative session. और मुझे बहुत बहुत हम लोग को उम्मीद है कि जो लोग हमें सुन रहे हैं उनको आज आप तीनों स्पीकर्स के हवाले से हमें बहुत ज़्यादा इन्फॉर्मेशन उनको आज हासिल हुई होगी कि कोविड-19 एंड उसकी जो है वैक्सीनेशन के रोल के हवाले से कि किस तरीके से जो है हमें कोविड को समझना है, जानना है और उसकी वैक्सीनेशन के हवाले से किस तरीके से हमें इसको अंडरस्टैंड करना है. Now we will move our question and आंसर सेशंस. तो कुछ लोगों के जो है हमारे पास क्वेश्चंस आए हैं तो उसको मैं आप लोगों के साथ शेयर कर लेती हूँ कि फर्स्ट मेरा क्वेश्चन जो है डॉक्टर उमर बगासरा साहब से है कि हाउ आर दीज वैक्सीन मेड एंड व्हाट टेक्नोलॉजी डू दे यूज. ये हमारा पहला क्वेश्चन आया था एक हमारे प्रेस के लिसनर के पास से जो
Very good question. Vaccines are nowadays extremely easy to make. We use a vector. So vector is basically, I want to give you an example of it. Vector are actually viruses which are non-pathogenic viruses. It could be DNA virus, could be RNA virus. They are circular. This is circular. And what we do, we keep the virus. So this virus are non-pathogenic. They don't cause any disease. But what we do here, we put the spike protein. So we hook up a spike protein. This virus, when it replicates, is going to produce the spike protein only, not anything else. And your body will respond to it thinking he is attacked by a dangerous virus. It would make antibody to it, but person would not get sick. Now, some people will have some minor fever, small fever sometime because of its making lots of protein. Lots of immune system is attacking this and making a lot of protein. There are 3 different ways to make vaccine. One I mentioned to you is a very ancient, almost 100-year-old technique, very simple to make. You basically grow the virus. You grow the virus in a big fermenter. You use the cell line, which virus is growing. So we use lung cell line or whatever cell line. There are many cell lines. You figure out which cell line makes the most virus. It's very easy to know. And you grow the virus in a laboratory, special laboratory, P3 laboratory, highly secure. You have to wear a gown and all weird stuff on you, like you're in space. And then you grow the virus, take the virus out by centrifugation and put formalin in it. Once you put formalin, this virus is dead. You basically give the small amount of that virus as an injection. Your body thinks it's been attacked by a real virus and will make antibody against multiple protein. So this will be multivalent vaccine, and I think it lasts much longer than the genetically engineered virus. So genetically engineered virus will be RNA or DNA, or you can use the whole virus. And the third way is to actually get the peptide. You have genetically engineered virus, you don't give it to anybody, you give it to cells in a liquid, in a big fermenter. Cell will make antibody, will make protein. You basically get the protein and inject the protein into person, will be just this. This is the spike protein, and body will make antibody against that protein. So there are 3 different ways. and we use all three methods for various vaccination. So in reality, anybody, essentially any laboratory which has BSL level 3 facilities can make vaccine, including Pakistan. Pakistan, we have 6 different places where they are highly sophisticated level 3 laboratories. And we can make in Pakistan. It's very easy to make. There's no really big, huge secret to it. I hope I answered the question.
Thank you so much, sir, for your answer. And उम्मीद है कि जी के लोगों को अब समझ में आ गया होगा कि what technology do they use for making this vaccine. Now our second question for Professor Dr. Rafiq Khanani. The question is this: how long does production last after taking the vaccine?
How long, what lasts? Immunity?
Yes, sir.
So immunity lasts according to what kind of vaccine they made. If it's only against the spike protein, it's only against the only making glycoprotein for spike. Glycoprotein spike has 2 N to it, so I'm going to give you this N and this N. This one this protein binds the actually responsible for binding to the ACH receptor or specific receptor in your body. So this is my lung cell, it will bind this. And this protein will allow this virus to enter by using fusion. So this is the way it will enter this virus. How long it lasts? This is actually a secret. We don't know. We do not know any of the RNA virus or DNA virus vector how long the immunity lasts. Only thing I can tell you, the whole virus is like actually somebody got viral infection. And we know person have no symptom, but those people immunity at least lasts for 5 months. I think it lasts for whole life. Now there's one other reason I want to mention the why I think we should use the whole virus vaccine because we do not know if this virus is going to mutate. So if you have immunity against multiple different proteins, if it's mutated, you're still protected. But if you only against one and that spike protein mutated, you have no immunity.
Thank you,
You see
sir.
my point?
What is your point? Dr. Rafiq Khanani, what is your opinion about this question?
In fact, I would like to ask a supplementary question from Bagasra. Dr. Bagasra, regarding the oral vaccines for COVID-19, are there any vaccines in pipeline that can be taken orally for prevention of COVID-19?
No, the reason is this, that we take live polio vaccine for polio virus because polio virus actually infects your GI tract, actually binds your part of your intestinal part of your epithelial cell. They have receptor. But we do not have, human do not have any receptor in our respiratory part of our body against the COVID. We don't have SEH2 receptor. So it's very unlikely that we can make oral vaccine, but we can make nasal vaccine. Because bind all through here, all the way through here, all the way through your lung. So nasal vaccine will be more logical thing to develop eventually, not right now. Right now, all these industries are doing, most of are making money. They're making billions of dollars out of this because this is the money making opportunity for those people. But our nations, I think our nation, developing nation, joined hand together. Pakistan has one of the most outstanding facilities in the world. If anybody seen HEJ, anybody seen other facilities in Pakistan, we have unbelievable facilities. I've been there, so I know. So we can do that, and we can join hand with many other nations, developing nations, to develop alternate way, easier way, cheaper way to make vaccine. It's easy to do. How difficult it is to just spray in the nose. I mean, how difficult? It's not difficult, and you can genetically engineer virus. You can generally in totally non-pathogenic system. You can inject it. Easy to
I
do.
think that's an excellent opportunity that Dr. Omar is mentioning, and maybe we should take forward following this discussion, and then how we can plan for, especially the nasal option that you are suggesting. This is very important for us to take it forward. And the number two thing that you mentioned about a single dose vaccine, because definitely follow-up will be very important. Compliance will be an issue in terms of two doses vaccine. So single vaccine should be an alternative.
Yeah. It will be very difficult for if in our nation, any developing nation, to bring the person twice for the same shot. Very difficult to do.
We
And
have seen this in case of the hepatitis B vaccinations. That's issue that we are facing. The hepatitis is already there, and then
yeah,
the disposal of syringes, as I mentioned earlier, has been a very important issue in terms of its reusage. In fact, we confiscated about 50,000 syringes at one spot that were going to be resold in terms of the syringes used, and then the injection users, the addicts that we have. So they will find syringes. So there's a lot of issues in terms of when we are dealing with the injection-based procedures.
yeah.
So there are a lot of issues.
I think Pakistan. You folks are in a very high level with grace of God. You guys should really get together with our other scientists, and it should be very difficult for us to Pakistan to lead that project. It's not difficult to do, by the way. It's very simple science. It's not complicated science.
Thank you so much, Dr. Rafiq Khanani, Dr. Umar Bagasra. But we have one very interesting question. Question is, would someone still be able to transmit coronavirus even after he has been immunized? And I would like to request Dr. Kidwai, please answer this question.
Well, definitely virus transmission is there, but as said earlier, that the vaccination lasts only for 5 months, not more than that. So transmission definitely may be there. Dr. Omar, what is your opinion on that?
Well, it depend what person is. Remember, our immune system is different from each other. So all the vaccine, not this one only, they are not 100% effective. So some people will probably get vaccinated and still get infected. Very few, but still possibility is there. Similarly, if somebody has been infected before, has been infected or vaccinated, and his or her immunity may wither away faster than the other person. Also, people like us who are older, our immunity is low. We don't have a very high level of immunity at our age. So our immunity response is going to be much lower than somebody 18 years old. So I think that's going to be a variable factor in anywhere in the world with vaccination.
The other thing is that these
Correct.
vaccines are focusing more on diseases rather than vaccines. So that's another issue that we have to face. That these vaccines are right now focusing on disease, not on infection prevention or infection control aspect.
Thank you, Dr. Kidwai. We have one more questions. How many doses are needed? And Dr. Rafiq Khanani, if you would like to answer this question, please.
I think Professor Omar has already responded that for these vaccines like Moderna and Pfizer, two doses are required 21 days apart. Oxford vaccine, which is prepared by AstraZeneca, it also requires two doses 28 days apart. And the Chinese one, which Professor Omar has talked about, is I think again two doses 21 days apart. I would like to ask one question, which is a kind of people propagating through conspiracy theories, is that these messenger RNA vaccines, since they are new and they might contain certain codes which can be used as an identifier and certain data to be transmitted through it globally to control your genes. So,
So I already answered that question. mRNA are extremely unstable. The reason we giving them intravenously or intramuscularly, because they do their job very quickly and within days, actually within hours, they disappear, they fall apart. RNA is extremely unstable. Okay. So if anybody has any doubt that there is any kind of a message, being sent to our body, this is not the way to do it. I think we don't have a technology or anybody has technology to actually identify you through any kind of vaccination process or any process unless somebody put chip in your body. Right now, the only way to identify you is to somebody put chip behind your neck, but they already have. They don't need vaccine for it. The people who want to identify you, you already do it yourself. Here is your identifier. All the information about you is in your cell phone. Whenever you talk to, how you talk to, what you do, they know everything about you through profiling.
Yeah, somebody said COVID as a certification of vaccine ID as an acronym.
No, they already know how that is done, and I can tell you how it's being done, but that has to be part of another lecture. This is not the lecture time to do that. So about it, I just want to ask you a question to my listener. How that much data from billions of people can be collected and deciphered? Because they know everything about you through this. How? That's another lecture for another time.
Thank you so much, and I would like to thank again to Dr. Umar Bagasra, Professor Dr. Rafiq Khanani, and Dr. Minhaj Qidwai for this very informative and wonderful session. And जो हमारे पास आज के लिसनर्स थे थे जिन्होंने हमें आज इस सेशन में ज्वाइन किया, उनका भी बेहद शुक्रिया कि आज उन्होंने जो है इस तमाम चीज़ों को जो है देखा होगा, उन्होंने इन तमाम चीज़ों को आज जो है समझा होगा कि जो है कोविड-19 में जो है वैक्सीनेशन का क्या रोल है और किस तरीके से जो है हमें इसको अंडरस्टैंड करना है। और जो हमारे पास इस तरह के जो हमारे पास जो है इंफॉर्मेटिव सेशंस होते हैं, क्योंकि हाशमानीज हमेशा से ही जो है लोगों को एक इंफॉर्मेशन पहुंचाने का जो है एक जिम्मेदारी है कि भाई हमें जो है लोगों को इन्फॉर्म करना है कि जो हमारे पास रिसेंट अपडेट्स होती हैं, जो रिसेंट बीमारियां होती हैं, उसके लिहाज से हम लोगों को एक ऑथेंटिक इन्फॉर्मेशन पहुंचाएं। तो इसमें जो है आप सब लोगों का बेहद शुक्रिया कि आप सब लोगों ने हमें ज्वाइन किया इस सेशन के लिए, और फिर हमें अब आइंदा आप लोगों के फीडबैक का भी इंतजार रहेगा कि आप लोग हमें फीडबैक भेजें और बताएं कि अब नेक्स्ट, क्योंकि ये तो आज समझे इस सिलसिले की एक कड़ी थी। इसके बाद हम डिफरेंट जो है टॉपिक्स के हवाले से और भी जो है हम सेशंस लेकर आएंगे। और कोविड-19 के हवाले से जहाँ तक बात है, आज हमारे तमाम मोस्टली जो हमारे रिस्पेक्टेड पार्टिसिपेंट्स थे, जो हमारे पैनलिस्ट हैं, उन्होंने हमें कोविड-19 के हवाले से बताया कि हमें उसकी जो है वैक्सीनेशन के बाद भी, उसकी तमाम ट्रीटमेंट के बाद भी हमें एहतियात हमें लाजमी तौर पर करनी है, क्योंकि एहतियात इस सिलसिले में हम जब तक हम एहतियात नहीं करेंगे तब तक हम खुद को भी और अपने घर वालों को भी इससे जो है महफूज नहीं रख सकेंगे। तो स्टे सेफ एंड स्टे हेल्दी, और जो आपके पास कोविड-19 के हवाले से SOPs हैं, उन पर मुकम्मल तौर पर अमल दरामद करें, मास्क का लाजमी इस्तेमाल करें, और अगर आपके फैमिली में, आपके इर्द-गिर्द में या खुद आपको भी इसके कोई साइन एंड सिम्टम्स ऐसे वाज़ेह नज़र आ रहे हैं कि आपको नज़ला खांसी है, बुखार है, तो फौरी तौर पर अपना जो है कोविड का टेस्ट करवाएं, और जो आपके कंसल्टेंट हैं, फैमिली डॉक्टर हैं, उनसे उनके मशवरों पर लाजमी अमल करें। तो इन सब एहतियाती तदाबीर पर अमल करके ही हम खुद को भी और अपने घर वालों को भी जो है कोविड जैसी वबा से महफूज रख सकते हैं। तो अब आइंदा सेशन के लिए आप सब लोगों का जो है वो आप सब लोग हमारे आइंदा सेशन में भी जो है पार्टिसिपेट कीजिएगा, ताकि हम लोग अपने जो हमारा एक ये तालीमी सफर है कि हम लोगों को एजुकेट कर रहे हैं, उसमें हम इसको मजीद आगे लेकर जाएं। तो नेक्स्ट सेशन तक के लिए बहुत बहुत शुक्रिया एंड अल्लाह हाफिज़।
Thank you, Hashmanis,
I want to
for
thank
joining us.
everybody.
Thank you. Allah Hafiz.
Thank you for everybody. I thank everybody for it. Allah bless you. Allah protect you from any kind of illness.
Ameen.
Stay home, stay safe.
Thank you,
Khuda.
sir.
Thank you, Allah Hafiz.
Thank you for invitation. Thank you, Rafiq. I really appreciate for invitation.
Thank you, Umar Sahib and Rafiq Sahib also. Allah Hafiz.
Allah Hafiz.